As the virus shifted from community to community, Russo needed a way to track available masks, the saccharin solution, and the personnel needed to administer mask tests. If she could, she'd be able to transfer supply and personnel to the hardest hit places. But as if the mask and PPE difficulties weren't enough, personnel shortages set in. The caseload threatened to overwhelm existing staff, and to make matters worse, some healthcare workers came down with the virus. Russo and her team put the call out for additional personnel, and the medical community responded. But how could Russo ensure that these new and existing workers, 35,000 individuals spread out over 13 affiliates, hadn't traveled to COVID hotspots around the world in the days just before the pandemic hit New York? There were other employee concerns too. If an employee was exposed to the coronavirus, how could she track quarantine times and testing results to ensure the workers were cleared to return to work? How could they screen those who might be asymptomatic carriers, who might inadvertently transfer the disease to an uninfected patient who is in the hospital for a different issue? More complicated still, how could they ensure that the employees with underlying medical risks, conditions that might make COVID infection life-threatening, weren't placed on COVID wards where they might be exposed to the deadly virus? It was crisis management on the fly, and Russo needed real-time access to exposure notifications, travel histories, PPE needs, inventory supplies, employee temperatures, and potential vectors of transmission. And this mountain of data needed to be monitored by more than just Russo. It needed to be accessed by administrators at various hospitals across the region. Once they had the data, they needed to be able to modify it on the fly to make sure everything was up to date in real time. It was too much. Absolute insanity. Those were her words, not mine. Russo had called to thank me for the work our company, NetHealth, had done to provide software and support. RWJ used our occupational and employee health system to track all the data and ensure that healthy, well-prepared caregivers were on the scene so that their workforce didn't become super spreaders. Perhaps more importantly, with our software, Russo was able to keep track of N95 mask supplies and refitting solutions and was able to shift resources as needed. There's no doubt this saved lives, she said. An analog solution would have been useless against this kind of pandemic. Your system was connected, easy to understand, and agile. Thank you. We'd played a role in the war on the pandemic, and Russo wanted me to know. Before our goodbyes, she told me she felt her team represented the heroes no one saw coming. We were part of that team, she said. As I hung up the phone, I stepped off my front porch and onto the grass. I took a deep breath, considering how this story might have turned out differently. If we hadn't put the time, effort, and energy into refounding a tiny company, one on life support no less, how many lives might have been lost? Ours is a refounding story, a story of a group of people who took a broken company and built something better. How did we do it? That's what this book is about. But it's not just our story. In this book, you'll meet one of the world's top innovators and one of the country's most agile educators. You'll meet an incredible community organizer who is taking back city blocks, and a reporter who, despite having an average viewership of 2.5 million, switched gears for purpose-oriented entrepreneurship. You'll meet healthcare professionals who are in the business of saving limbs and lives. What do they have in common? When they came face to face with the brokenness of their own world, they didn't run away. Instead, they took a sober look at the world around them, focused their efforts, imagined new possibilities, and worked to create a better world for the people in their organizations or communities. They refounded their respective industries, neighborhoods, and even their lives. It seems we come face to face with more brokenness by the day. The failure of politics, of communities, of corporations, of leaders. But what if the brokenness of our systems, whether corporate or otherwise, is an invitation to pause, reflect, and ask a simple question? Is there something here worth refounding? Through the stories of refounders throughout this book, we'll begin to work toward a fresh approach with a new mentality.